All right, I'm going to go ahead and get started because we have a lot to cover and I want to be cognizant of your time. I'm Megan Ockett. I'm the program director with Healthy Birthday. I'll go into a little bit more detail of my background here shortly. Just a couple of housekeeping things. This is being recorded, so you can share this. I'll send out the recording afterwards. You can share it with your team that isn't able to join today. Keep it, share it with new team members. The whole point of this presentation today is to get you familiar with Count the Kicks and how to talk about Count the Kicks and stillbirth prevention with the clients that you serve, the expectant parents that you serve, and to share about the resources that you have available to you with our partnership with Silver Summit. I'm going to turn my video off for the majority of the presentation, just because I have videos playing and I don't want to be a distraction. But I also wanted to share that feel free to ask questions in the chat as we go through. I hope to answer all your questions as we go through, but this way you won't forget them and then I can address them at the end. So with that, I'm going to go ahead and get started. I always like to start off with some of these beautiful, beautiful faces that you see on your screen. These are just a handful of our baby saves, and a baby save is somebody that was using our app or learned about Count the Kicks from either a provider or their social worker, or they saw a brochure, they got a mailing about it, knew the importance of tracking their baby's movements, noticed a change in their baby's movements, a significant change, spoke up to their provider, and now baby's here because of it. So we have over 100 baby safe stories that we know about. We know there's countless more out there, but I just like to start off with some of these ones. They're all beautiful, but you can read more about their stories on our website. And then the other thing I like to do to start off is I like to play a feel-good video. So let's watch the impact of Count the Kicks.
We're going to turn now to that GMA Parenting Alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
Life with their new baby Ruby is extra precious.
We have a healthy baby girl and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
So that just is a good overview of the impact of Count the Kicks and our work that we do. Like I mentioned earlier, my name is Megan Ockett. I'm the program director with Healthy Birthday, Inc., which is the nonprofit organization that created Count the Kicks, which is our evidence-based stillbirth prevention program that you're going to learn about more today. My contact information is on the screen. Feel free to reach out to me if you have additional questions or thoughts. I'm always here to listen and try to make whatever resources you need to make this easy and inclusive for you to use, because you're the boots on the ground. You're the one that's going to share this with your members, with your clients, with your expectant parents. That's going to make all the difference. I have about 15 years of public health experience, specifically around prevention and education. And I really, really enjoy systems level change. So any way we can integrate Count the Kicks into your current workflow to make it easier so you don't have to think about it. That's really what I love to do. And so I'm just excited to be here today. Knowing your background, I'm sure you already know the definition of stillbirth, miscarriage, and infant mortality, but just in case, I kind of like to level set and talk about this just briefly. Obviously, what we're talking about today is stillbirth, which is the loss of a baby after 20 weeks of pregnancy. It's further classified as either early, late, or term. And on average, we lose around 23,500 babies every year to stillbirth in the United States. Then there's miscarriage, which is usually defined as the loss of a baby before the 20th week of pregnancy. And then infant mortality, probably the one that gets most confused with stillbirth, is death of an infant before his or her first birthday. On average, we lose around 22,000 infants every year from infant mortality. And so what I really want to draw your attention to on this slide is the fact that we're losing just as many babies to stillbirth as we are to infant mortality. Yet we don't talk about stillbirth as much as we talk about infant mortality. And this isn't to underscore the devastation and tragedy of infant mortality and the need for talking about things like safe sleep practices and SIDS prevention and things like that with infant mortality. What I want to do is show you that we need to be talking about stillbirth and stillbirth prevention just like we're talking about infant mortality just as much, because if we don't talk about it and we don't address it, it's never going to change. And that's what we want to do today, is to learn how to talk about it and to talk about it in an empowering way. And so what Count the Kicks is, if you're not familiar, it's an evidence-based stillbirth prevention program. It educates expectant parents on the importance of tracking fetal movement in the third trimester, and it empowers expectant parents to speak up to providers if there's a concern. So we're going to talk about that in a little bit, about how exactly it does that and how what your role is in ensuring that happens. And so we'll do that in just a little bit. Before we dive into kind of the implementation and the app and all those tools, I wanted to give you a little bit more background on stillbirth and the national data that we have, as well as your state-specific data. And so families are 6.5 times more likely to lose a baby to stillbirth than to SIDS. We just talked about that with the infant mortality. And we know nationally that 1 in every 173 pregnancies will end in stillbirth. And the racial disparities persist and exist, and we need to address those. Native Hawaiian or other Pacific Islander expectant parents, 1 out of every 94 pregnancies will end in a stillbirth. Black expectant parents, 1 in 97, Indigenous, 1 in 128, Hispanic expectant parents, 1 in every 205 pregnancies, White expectant parents, 1 in every 211, and Asian expectant parents, 1 in every 254. So you can see there's a clear disparity there between, especially between Native Hawaiian or other Pacific Islanders and Black expectant parents. And every state differs slightly. So depending on the demographics of your area, depending on the populations, you would have, you could have different disparities. So what we really want to do is get Nevada to a point of where we're at in Iowa, which is where we're based out of. We're a national organization, but we are founded in Iowa and we all work in Iowa. So Count the Kicks was created in 2008, and you can see right there that TL dot is probably the highest or close to being the highest on the graph there. And from 2008 to 2018, we saw in Iowa a 32% reduction in the number of stillbirths. Public health officials have stated there really wasn't anything else going on in Iowa that would have made such an impact other than the inception of Count the Kicks. In addition to that, in the first 5 years of the campaign, we saw a 39% reduction in the number of African-American stillbirth rate. It decreased around 39%. And then you can see what we're really looking at is that dashed line. So we really want to see that dashed line continue to trend down. We continue to be at a low rate. In 2021, the Iowa stillbirth rate is 4.1 fetal deaths per 1,000 live births. And so there's some outliers there. You can see where the TL dot kind of spikes up. Some things to keep in mind are things that we are out of our control. One, not every stillbirth is preventable, but things like a syphilis outbreak, a pandemic, all can impact the stillbirth rate. but this is where we want to see Nevada. And where Nevada is right now is quite a bit higher than Iowa and higher than the national average there. So you can see based on the most recent 5-year average, the stillbirth rate in Nevada is 6.8 deaths per 1,000 live births. And then if we compare that between the United States and Iowa, you are the red line and the US rate is the teal line, and yellow is Iowa. So what we'd love to do and what we need your help with is to get that red line to the yellow line or even past the yellow line. That's our goal. Nevada loses on average 245 babies a year due to stillbirth. If we implement and replicate Count the Kicks and see the success we've had in Iowa and Nevada, we have the potential to save 78 Nevada babies on average from preventable stillbirth, which will heavily decrease that stillbirth rate. So I briefly talked about the different race disparities that exist, and what I didn't talk about was why. And so I think it's really important that we address this and that we talk about this and that we continue to look at ways to close that gap. And so things like systemic racism, racism in the healthcare setting, toxic stress, epigenetics, predisposition to certain conditions, access to healthcare, socioeconomic barriers are all things that researchers point to the cause of the disparities. Research shows education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school-educated white woman. So here are some of the things that we're doing to reduce disparities that exist and persist in stillbirth. And I'd love for you to think about the things that you're doing or that you could do as an agency, as an organization within your own teams, because we can all work together to do this. We have an app in 16 languages, which we'll talk about in a second. We have culturally appropriate educational material. We have videos, printed educational materials, and FAQs in multiple languages. We have a health equity team. We're always looking for funding opportunities to reduce racial disparities that persist in stillbirth. We're an inclusive organization with 100% board and staff trained on anti-oppression and structural racism. We're improving our programming based on lived experiences shared by people of color, and we have community outreach beyond the healthcare setting. And with our partnership with Silver Summit, it's really exciting because they also see the need for reducing these disparities and really have centered equity in this contract that we're working with them on. And so some of the things that we're doing specifically are we're reaching and working within the faith-based community. We've done research and focus groups and shown that a lot of times people, especially African-American individuals, get their information from a variety of different sources and trusted sources, things like grandparents, friends, and their pastors or ministers. So we created a faith-based toolkit that we've launched and things like that. So we're really excited about this partnership with Silver Summit. So a little bit about the research to give you more background, and perhaps you're really one of those individuals that love research, you love reading journal articles. More power to you. We have a whole webpage dedicated to evidence, but I do want to highlight just a couple because I know there's questions out there and there's thoughts, and so hopefully I can address those head on with some of the evidence that we have. And so when I talked earlier about how we were founded and that we were created in 2008, what I didn't tell you is that we were actually founded by 5 Central Iowa women who all experienced stillbirth or infant loss in the early 2000s. The time of their loss, they didn't know each other. They got connected through pastors and friends. And as they started grieving together and connecting and realizing this is a lot more common than people think. Stillbirth happens a lot more often than people think or say. Fast forward a couple years, and one of the things they did was they were at a public health conference, a couple of the founders, where they heard researchers out of Norway talk about a study that was done that when expectant parents were educated on getting to know what was normal in terms of movement for their baby at 28 weeks and beyond, that among this cohort, the stillbirth rate decreased around 30% with this Norway study. And so the founders hearing this said, well, that's amazing. You know, Kit County's been around for a really long time, but what wasn't created was the tools and resources for those that work with expectant parents to be able to talk about stillbirth and stillbirth prevention, as well as the tools and resources for expectant parents to understand the importance of fetal movement monitoring. So they came back to Iowa, they worked and looked at other research. They worked with Iowa Department of Public Health, and they created the Count the Kicks campaign that you know about and have seen today. This research study, this is the Norway study highlighted on your screen here. You can view it on our evidence page on our website. But I highlight Dr. Ruth Fretz. She was one of the researchers on the Norway study. In fact, she was the only United States researcher on the study. And she stated that tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the 3rd trimester of pregnancy. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern starting at 28 weeks and to speak up if they notice a change. And so that normal movement pattern, that's what we're really going to pay attention to throughout the presentation. I'll talk about why later on. I think the top question I get a lot of times, and that you'll probably get, especially as you go out in the community, as you work with other providers and you educate them on this and tell them about this, is, I don't know if I want to do this because isn't this just going to increase the anxiety of my patients? I've even heard things where doctors say, I don't want my nurses running all over answering phone calls. And so as frustrating as that to hear, I'd like to address the fact that this does not increase anxiety in most pregnant women. I think as humans, we always jump to that worst possible case scenario, but I'm here to tell you that doesn't happen with this. This quote here from another research study stated that one potential side effect of routine monitoring of fetal movement could be an increase in prenatal visits, either outpatient or in the hospital. However, most research has not found this type of increase to be true, and that usually the fetal movement count is reassuring to pregnant women and prevents unnecessary visits. Because once they begin to understand what's normal for their baby in terms of movements, then they know that when and how to speak up if a problem comes up. We've also done our own study with the Des Moines University and the Harkin Institute. We have thousands of app users, and 84% of the app users stated that regular tracking was associated with feelings of bonding, and 77% of app users reported feeling less anxious. The researchers also stated that using a mobile health app to empower mothers to monitor their baby's fetal movement, that preliminary research shows the mobile health app increased awareness of a change in fetal movement and a reduction in stillbirth, because especially with the app, they now have data in their hands to say, this is my baby's normal, or this is not my baby's normal. I know because I've been tracking and I have the data right here to show it. I think there's other added benefits that I like to share that people don't always think about. I think, again, people think kind of worst case scenario where everybody's going to get an emergency C-section, and that doesn't happen. In Iowa, we have not seen an increase in C-section rates, but we have seen a dramatic decrease in the stillbirth rate. The other benefits that this has is it can have a reduction of preterm birth rate. Fetal growth restrictions are identified earlier because people know what's normal for their baby. So if something's going on and the movement changes, maybe it's something where they're having contractions and they don't know it yet, and baby's trying to be born early, and the providers can do things to make sure that doesn't happen. We also know that women who have stillbirths are at substantially higher risk for severe maternal morbidity than women who have live births, regardless of the cause of fetal death. So this quote I really love from the research study that says, due to the low cost and potential benefit, it is recommended. Decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. Because think about it. Once you go in with reduced fetal movement, you get checked out. It's not an automatic C-section, right? They do additional testing, make sure you and baby are doing okay. So that connection between stillbirth and maternal mortality and morbidity, we know what a hot topic maternal mortality and morbidity is in the United States right now, as well as it should be, but so should stillbirth and stillbirth prevention. And so we know, and there's research that shows you're 4 times more likely to die if you have a stillbirth. According to one study, more than 15% of maternal deaths within days of a delivery occur in women who experience a stillbirth. And so we know that it's imperative that providers are proactively discussing stillbirth prevention and risk factors with the patients and providing evidence-based solutions like Count the Kicks to every patient they work with. So we have a white paper out there on our evidence page that you can view and read. And it also includes firsthand accounts from women in the United States on their experience almost losing their life, but using the app, and how that saved both their lives. And so you can read that via the QR code. And I'll also send it in the follow-up email that I send after the presentation. All right, what you're here for. How would you implement this? You know about the data, you know about the research, you know, kind of the background, the history of the organization. So how do you implement this? When should you start talking about this with your clients and members? So I want you to share this with your team. I want you to start talking about Count the Kicks and fetal movement monitoring with your members around 28 weeks. So right around that third trimester. If you know that they're high risk, which my guess is you probably do, you can start having these conversations at 26 weeks. This is really when research has indicated baby has established that consistent pattern that moms can feel and track. So when you're talking about Count the Kicks and what that means with your members, you can explain that it means those rolls, those kicks, those jabs, those pushes, those, you know, those whole body rolls, everything and anything except hiccups. That's usually a top question from expectant parents. One is, what are hiccups? What would those feel like? And two, do hiccups count towards the movement? Because hiccups are involuntary, they do not count towards the fetal movement monitoring count that they're doing. And then how you can explain what a hiccup is, I'm sure you all do this anyways, but it's really that specific, that consistent movement that happens throughout the day periodically. I know my kiddos always got hiccups throughout the day, and it was very rhythmic. So it was easy to tell after a couple times of when it was hiccups and when it was a movement. So now let's learn a little bit more about our Hallmark tool, our free Count the Kicks app.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the third trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the third trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab. In the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the third trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
So that's a great video that you can share. It's also on the app, but I wanted to give that overview before I went into a little bit more of the features of the app. One of the things I'd love for you to do right now is to open your app store on your phone and search for Count the Kicks. And it's the little yellow clock icon, and download it, because what I want you to do is to create a profile. Even if you're not pregnant, I have about 18 in there, and just use it, see how it works, become familiar with it so that you can share it with your members and when you talk to them about this. So you kind of saw in that video how she was using the app. She was tapping the footprint every time she felt baby move and a timer started. And then what happens is after a couple sessions, the app user will see a graph. So you see that there on the back of a visual representation of how baby's been moving. So on average, how long it takes baby to get to 10 movements. And then they also see the individual days that they're counting. And so it's imperative that you share with your expectant parents that you want them to count daily around the same time each day. So choosing a time when baby's most active, or just whenever it works in their schedule. Perhaps it's 2 o'clock in the afternoon because they have a 15-minute break and it's the only time they can sit down and veg out and look at their phone. They don't have time in the evenings with other kiddos and things going on. Or maybe it's right after dinner and they're waiting to put their other child to bed. Could they include the other sibling and say, come on, let's go check, baby's movements. Let's read them a story. That enhances that bonding and that family experience as well. And so that's really how it works. It's that visual representation. So for example, if I was counting and this was my baby here on this chart, it looks like it's around 15, 16, 17 minutes. I get 10 movements, and one day I'm counting and it took, I don't know, an hour and 15 minutes. What happens then is that chart visually changes, showing me as a user like, that's not my baby's normal, right? My baby's normal is around 15 minutes, not an hour and 15 minutes. And I see that change on the graph. I'm going to contact my provider and see what they want me to do. So the app comes in 16 languages. You can see those languages on the screen. One thing I want to highlight is if there's a language, demographic, or population that you work with that you do not see the language on the screen, let me know. And then I can take it back to my colleagues at Silver Summit and say, hey, this is what we're hearing. Like, this is what the community needs. How can we make this happen? Because again, we want to make sure this is meeting your needs, that this is meeting your expectant parents. And we can only do that when you let us know if we need to do something in addition to what you already see. Some other features is you can restart a session or delete a kick. Perhaps like they counted a hiccup and they didn't mean to do that. They can review their kick counting history. And one of the best features, I think, is that a user can actually download their history and share it with their provider. They can share it with you. They can share it with others. They can print it out and take it to a provider, to their doctor's appointment. They can download it and share it as like an image on like their My Chart. So I think that's really key. That goes back to that advocating and empowering them to speak up to their provider. Even if their provider's not talking about this, encourage them and say, hey, bring it up to your provider and say, hey, I learned about this Count the Kicks app. Here's what I'm doing. I wanted you to know. You can track future pregnancies. You can count for single babies or twins. It's also available on the smartwatch. So you could be counting one day on the smartwatch and then just the Apple Watch, and then you could count on your iPhone the next day. And coming soon, which we're really excited about, is a web-based kick counter. So you could count on the PC and one day you count on your mobile phone. This is going to be really helpful for those of you that work, especially with people in rural areas where Wi-Fi tends to be an issue and broadband. They could go to a library and count. Maybe they can only count at work during their 10-minute break, but they can't take out their phone. They can go to a friend's house, or maybe they just prefer sitting down at the computer and doing that. Either way, be sure to sign up for our newsletter so you can see when that actually gets announced and live. It should be within the next month. So this is just another way for you to explain how to count movement and how to track babies' movements to your members. So you want to encourage them to start tracking in the 3rd trimester. They can download the free app, or we have paper kick counting charts on our website in multiple languages. So if they want more of the traditional pen and paper, we also have that available. They're going to count their baby's movements every day, preferably at the same time. And they're going to time how long it takes baby to get to 10 movements. The app already does this, but if they're doing this pen and paper, they obviously need to do this. Even if they're doing it pen and paper, they can still, if they're doing it around the same time, they'll still be able to see that trend of how baby's been moving. And the app does that, as you just saw. And then you want to encourage them to continue tracking every day. I've heard stories where people will track only when they think they notice reduced fetal movement, or just every other day. That's not how the app works. It really needs to be done daily to really understand the pattern and movement of their baby. And then really encouraging them to say, your provider is there for you. If you have questions or concerns, you feel like something's off, trust that mama instinct and go in, call your provider. If it's after hours, go to labor and delivery. They will always see you. And I guarantee you, they would much rather check you out than have you wait until the next day. So make sure that you're encouraging that with your members. Another resource that I think you'd be interested in is this in the resources section. We have a link where you can go and you can send your members to this Find Help resource on our website. where they can just enter their zip code and find free or reduced cost services located by them. It's located within, their zip codes. You can do radius, mile radiuses. And then you can search a variety of different things. They can search for diaper banks and food banks and childcare services and things like that. And so this is just a data collection like warehouse where they'll be able to see that. So this would be a great tool for you to share with your parents as well. So now that we kind of reviewed the app and you downloaded it, how do you talk about this? Nobody wants to talk about stillbirth. I get it. It's tragic. It's sad. It's terrible. And nobody wants to talk about it. But we have to talk about it. And we know that pregnancy is full of risks that we talk to people about all the time. I've had 3 babies. I've heard lots of different things. I've done lots of different blood work because I was told not to drink. I was told to take my folic acid and, all of these things. So why aren't we talking about stillbirth and stillbirth prevention? Stillbirth is another risk that people deserve to be educated about. Or maybe you're thinking, or others are thinking, stillbirth just happens, there's nothing we can do. There are warning signs if people know what to look for. And a change in baby's movement is sometimes the first and only warning sign that baby's in distress. This active one I include maybe multiple times throughout the presentation because I know that you're going to get this. I know that you're going to get this from your members when you bring this up. I know because I get it from my friends when I talk about this that are pregnant. And I always say the same thing. I always say, that's awesome. A healthy baby is an active baby. I still really want you to count your baby's movement so you can really understand and know if your normally active baby has slowed down. Tracking your baby's movements really gives you that detail and that data. So it takes the guesswork out of knowing it. So really encourage your users to do that. She's almost at her due date. We know the risk of stillbirth increases as a mom approaches or exceeds her due date, and it actually increases significantly. So always continue tracking up to and through delivery. So what about people who have had a stillbirth previously? How would you bring this up and talk about fetal movement? Well, you would do the same thing. You'd follow the same protocol. However, if you get their chart or you have their health information, I'm not exactly sure how it works with you all, but if you have that information, make sure you see that or read about it before you see them or meet with them. If not, and they tell you while you're meeting with them, of course, have empathy. And I know you all will. I know the type of industry you are in, so I'm sure that you do this. Because somebody who's had a stillbirth previously is more likely to have a stillbirth again, we really want them to start tracking their baby's movements at 26 weeks because they're considered high risk versus 28 weeks. And absolutely feel free to talk about the previous stillbirth, acknowledging their child, asking the name, the gender if you don't know. Again, that goes back to that empathy thing, right? Staying away from medical terms like fetal demise. I feel like that's common sense. And then ask them, has anybody ever talked to them about the importance of tracking fetal movement? A lot of the people that we've talked to who are like our ambassadors, they're lost moms who come to us after, unfortunately, the loss because they were researching, trying to figure out what happened. And so many of them have said, I've had perfect, healthy live pregnancies and births before this stillbirth. And I noticed a change in fetal movement. I didn't know I was supposed to speak up. Why didn't I know? Why didn't somebody spend 3 minutes talking to me about this? Why didn't I know? And so we want to turn that why didn't I know to I'm so glad I know. I'm so glad that I saw a social media ad. I'm so glad that my contact at Silver Summit told me about this and talked to me about this. I'm so glad I saw a brochure in a library and things like that. So that's what we want to do. Some other common myths that you may get, or perhaps you're thinking yourself that we want to address. We talked about the active one, and just another way of saying it. Some might think only high-risk pregnancy should pay attention to their baby's movements. We want every single pregnancy, every single pregnant person to pay attention to this. We don't just do the gestational diabetes tests with high-risk individuals. We do that with everybody. Same with this. It doesn't matter. This can happen in any pregnancy. 10 and 2. This is a very, very popular one. I get asked this all the time. Or 10 and 1, or I get told, oh, my doctor told me I just need to do 10 and 2, 10 kicks in 2 hours. And I get it. I've had 3 babies. I was told that too. But what we know now and what research shows is that the recommendation to expect 10 kicks in 2 hours is outdated, and that what current research indicates is that moms should really work to understand the normal amount of time each day it takes their baby to get to 10 movements. And the reason why, and there's research on this on our website, on our evidence page, but I'll explain it in a minute versus reading a journal article, is because this is what the research shows in my layman's term, if you will, but as humans, we focus so much on time. Like, you signed up for this. It'll be about an hour presentation. When your day ends and things like that, we're focused on the time, right? And so when we tell somebody 10 and 2, we focus on that 2 hours. So I could be counting every single day and get, 10 kicks in 15 minutes every single day for the last 3 weeks. And one day I'm counting and I get 10 kicks in an hour and 47 minutes. And I think to myself, well, that's okay because I still got 10 kicks in 2 hours. But that's not my baby's normal, right? My baby's normal for the last 3 weeks has been around 15 minutes, not an hour and 47 minutes. I'm going to contact my provider and see what they want me to do. So it goes back to that, what's normal for their baby, understanding what's normal for their baby, not comparing to friends, and definitely not comparing to other pregnancies. My firstborn, he would get 10 movements in 5 minutes or less. My second child, she took forever, at least during the time of day I was counting. It was always around 30 or 40 minutes. That is a little unusual. It was just when I ended up counting, maybe she was sleeping during that time. I didn't know that was her normal when I was counting. I was comparing her to my son. I went into triage 3 different times to get checked out, make sure everything was okay. Everything was fine. She's now 7 and wonderful and feisty and moves all the time. But I was comparing her to my son. And I also didn't know that that was her normal in terms of movement. So we really want to pay attention to that normalcy part of it. A Doppler device. I know these are popular. I know you can download apps. And I think one thing that we want to stress with our parents is that a change in baby's heartbeat is one of the last things to occur when a baby's in distress, and a change in baby's movement may indicate potential problems before the actual change in the heart rate are detected. So we really don't want people using a Doppler device unless they're medically trained. And even when you go in with a change in fetal movement, it's not like the provider only does a Doppler device, or at least I hope not. They're doing additional testing. They're doing NSTs and biophysicals and all that other stuff. Here's another common one. If baby's not moving, I should drink cold water. I should eat a Snickers bar. I've heard jump up and down. I should do jumping jacks to get baby to move. And so again, research has moved away from the idea that sugary drinks and the like are a good way to get baby to move. We know, and research shows, kick counts are best monitored without interventions like juice and candy. If a baby isn't moving like normal, parents should speak up to their provider right away. And so think about it like when you and I are sick. When we're sick, we're conserving our energy. We're maybe laying on the couch or sleeping and taking naps. We're not moving as much. We're not trying to chug Mountain Dew or eat a Snickers bar to get up and going. We're resting. We're conserving that energy. Same with baby in utero. If baby's not moving like normal, and we know what baby's normal is because we've been counting every day around the same time, why are we trying to force baby to move? Whether it's infection or low amniotic fluid or umbilical cord issues, we don't want to have those interventions to try to force baby to move. We want to just go in and get checked out. Old wives' tale, right? I remember my grandma saying, oh, you look like you're ready to pop, and that type of thing. You're running out of room. Where are you how's baby gonna grow, and all that stuff, especially with second and third, fourth pregnancies. And so just stress with your members that the types of movements may change. It's more jabs, fewer of those huge body rolls, but baby should move up to and even during labor. And again, if an expectant parent is monitoring their baby's movements at the same time each day, it should still take about the same amount of time to feel 10 movements. Triage doesn't need this information. In your work, what you do and how you go out in the community, if you're working with health systems and you're working with providers, please, please, please share the materials. Labor and delivery triage is the perfect place to have this information posters, brochures that we'll talk about here in a minute. Like I said, I went 3 times with my daughter. That would have been the perfect opportunity for them to hand me a brochure to say, get to know your baby's normal. This is how you do it. And then avoiding dental care. I think this is a common question from expectant parents. You know, they don't want to go to the dentist. They're not sure if they can go to the dentist. And again, encouraging them. I'm sure with your benefits, I'm sure they're amazing and that you have wonderful dental services. So make sure they continue to go to those preventative visits. And then some additional materials that you all have on hand. I've been working with Richie. I don't know if you know him, but what you'll have available to you and what will be going out to like your members is this educational material that you see here. It's called our At a Glance materials. There's posters, brochures in English and Spanish. And so be on the lookout for those. If you want some, let me know and I'll make sure Richie connects with you individually or whoever your lead is on your team. Because the whole point is and hope is that I'm going to send brochures and posters over to Richie to have for you all to have internally to share when you're out in the community and things like that. And then we're also going to do a mailing to all the pregnant members with the brochure. So everybody, all your pregnant members will learn about this through mailings and outreach. But this is why I wanted to have this conversation with you today, so you weren't caught off guard when somebody did bring it up, and encourage you to bring this up with your expectant parents. You don't necessarily need this materials on hand to show them. You have the app. There's a lot of digital free resources that you can share them, but now you know how to talk about it, and I encourage you to talk about it with your expectant parents. I see a question, so I'm going to stop for a minute. Yeah, that's a great question. So Holly asked, will there be electronic communication available to text or email members? We will do an email out through Richie and his team. I'll talk to him about that. I didn't know about your texting service. I know so many things have to go through the state. So I'll ask him about that. I can't electronically send out the brochure to you to send, but he does have an electronic version that I know they're using, and that's part of the contract. So I'll write down your name, Holly, and I'll make sure that we connect with you and see what he thinks about the email and the texting. That's a phenomenal idea with the texting. I did not even think about that. And so I will ask him how we can do that. And then you have access to this. There's this free training that you can do. Use the code SAVEBABIES-NV. I'll send that in an email as well. And you can access this training. It's similar to what I did today. It's a little bit more in the weeds. You read the research study. There's a whole equity DEI section that I highly recommend. And so share this with your team. But again, this is also being recorded, so you can share this with your team too. I think it's really, really important that you share this with your entire department and areas, anybody that works with expectant parents. And then, like I said, we have a ton of digital resources out there. Just go to our website, counttthekicks.org, and click on either for parents or for providers. The parents is great. You can send them. If you have one-on-one conversations with them, you can send them this academy. There's those YouTube videos we shared. There's a lot of different resources out there. There's resources on the app, so make sure to share it. And then I really wanted to highlight the fact that we're hosting a virtual baby shower for pregnant members. So I will send this image out to you, this PDF out to you as well. If you wouldn't mind sharing it with your expectant parents, this will also go out in a mailing. I'll ask about the texting. That's a great idea to promote it. It's February 21st from 11 to 1. And it's kind of like a childbirth 101 class in 2 hours versus going weekly. We talk about Silver Summit programs and offers that you all have. We spend about 10 minutes is all talking about Count the Kicks. And then we go into kind of like labor and delivery 101, what to expect for about 20 minutes. We talk about newborn basics for 20 minutes, safe sleep practices. We have somebody that's going to come from the state to talk about breastfeeding and chest feeding and formula. If you're interested in this, I know Richie was going to reach out and see if there's like a medical provider or somebody, but if you have experience in labor and delivery, let me know. We could use your input, because we really do the Count the Kicks portion. And then we're currently sharing this via email with our members engaged in case. That's awesome, because I've only seen like 2 people register. So I would love as much as you can to share this information. So I'll send this out again electronically too. I appreciate that. So that's exciting. And, you know, there will be giveaways. They can win a gift card, a pack and play, all sorts of fun things. And then the final resource that I wanted to share with you is that our ambassadors. So we have ambassadors all throughout the United States, and the majority of our states do have somebody that is local. We have Julia Taylor here. She lives in Reno. She's amazing. She is a lost mom. She's working in honor of her daughter, Sydney, that she lost on 9/11. And so if you ever need an in-person training or somebody to come to an event, you can reach out to me and I can get you connected to Julia, or she's listed, her website or her email's listed on our website as well. So she's amazing. They're highly trained individuals, and they can go to fairs and do press, media, whatever you need. And then, like I said, we have all those free resources on our website. And I always love to end on a baby safe story. So this is why we do what we do. And this is baby Nala.
She came back in after she had me put on the monitor and stuff, and she's like, we're just gonna take her. And I'm like, what? And she's like, you know, her heart rate is dropping every time you have a contraction. I was already scared, you know, because I was a high-risk pregnancy. So I basically learned from the doctor's office, the little yellow sign that was right there. Once she started moving, I was very alert with her movements, you know. That was what I lived for, just because I wanted her to, you know, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I mean, I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, you know, what if? Definitely to pay attention and count the kicks, you know. I feel like it's important just because had I not, you know, knew to do that, Nala wouldn't be here. Don't second guess yourself, don't feel bad or stupid, don't worry about insurance or the emergency room bill. Go check on your baby, you know, because your baby might not be here. You just pay attention, you know, seriously, like, it's your baby's life.
I like what Dana says at the end where she says, don't worry about the bill, don't worry about this, go check on your baby. And that's really the message that we want to get across to expectant parents too. Providers are there for them. I think so many individuals are so worried about bothering people, and I get it. Like I'm the same way, but when it comes to this, and even if you have the slightest question or hesitation, call them and get checked out. I think that's really imperative. Follow us, connect with us. You can reshare things. You can encourage your members to join our newsletter, things like this, where they'll always get updates. I'm happy to answer any questions that you have. Here's those faces again, and feel free to read our stories on our website. I just really thank you for this opportunity today. I know it's hard to carve out an hour of your time, and it takes energy and time to do that. And I know how busy you are. So I really do appreciate you doing that. I'm happy to answer any questions. I'll send this out. I'll send the recording. I'll send the slide deck. I'll send the PDF of the invite. Feel free to share with anybody that works with expectant parents. I think that's the biggest message I can give you today, is that it's important for you to share this with anybody else that works with expectant parents. So with that, I'm happy to answer any questions. Otherwise, you're free to go about 10 minutes early. So I'm glad I could give you some time back to your day.